One of my patients today asked about beta blockers. Beta blockers are medications that are often used by internal medicine or family care providers and cardiologists because they treat high blood pressure or hypertension, and they also treat tachycardia, which is a fast heartbeat. Beta blockers are also often used and have been used for decades in psychiatry to treat anxiety or even panic. It's not uncommon that individuals who maybe play musical instruments like in orchestras or even surgeons also use beta blockers to decrease a tremor in their hands when they operate or play a musical instrument. You may notice that sometimes if you're feeling anxious, or a lot of people when they're feeling anxious, they might actually have a little bit of tremor, and that can be treated with beta blockers. So beta blockers like propranolol, metoprolol, atenolol can be used in these kinds of circumstances in psychiatry. With that being said, it's important to note that they do have many side effects, and so you want to make sure that you fully understand the possible side effects of these medications before taking them. Side effects include decreased energy or tiredness. They can include feeling lightheaded or dizzy, particularly if you stand up too fast. They can cause someone to actually feel depressed or to fall into a depression, which people are often surprised to find out about. But every once in a while, every few years, I'll have a patient come in with new onset depression. I'll ask them if they recently started any new medications. They might say a beta blocker after an issue with their heart, for example, or a heart attack, and we'll find that they actually are having a depression as a side effect of these medications. Because these medications also treat high blood pressure and other heart conditions, it's incredibly important that you are taking them the way that they're prescribed and that you are under the close supervision of the provider who is prescribing that medication for you, whether it's a family care doctor, an internal medicine provider, a cardiologist, or a mental health provider. There are a couple of different types of beta blockers. Propranolol affects what you call your beta adrenergic receptors, which are on your heart, and they're also on your lungs and some other places. Those medications can be dangerous in individuals with pulmonary issues like asthma or COPD. And so there are some other beta blockers that you would call them angioreceptor specific, and those will not affect the beta 2 receptors that are on someone's lungs to decrease the respirations or affect a person's breathing, particularly if they have an underlying pulmonary vulnerability. So obviously these medications are pretty complex, and if you wanted to discuss further, make sure that you discuss directly with a medical or mental health provider at an appointment in terms of whether or not they are the right class of medication for you.